Hi, my name is Megan, and here with me is Joe, and we are the pharmacists on staff at this facility. We've recently met with Mr. Sun. He is a 50-year-old male who was recently admitted to the ICU for pneumonia. He was coming down and complaining of a really bad cold, and his symptoms started about 3 days ago with a productive cough with greenish yellow phlegm. He was complaining of nausea, vomiting, diarrhea. He had a high fever and he was very fatigued. He tried taking OTC medications, including Mucinex for his cough, as well as ibuprofen for his fever, but both of those provided very little relief. The patient has a history of IV roxicodone abuse and has been clean for about 2 years. And he is a colon cancer survival and been in remission since 2012. The patient's blood pressure is low at 88 over 44. His respiratory rate is elevated at 31 breaths per minute, and his temperature is currently at 102. Upon examination of his chest x-ray, there was air filtration and space within the right middle and lower lobes, and this is highly suspicious of pneumonia. The medications that the patient is taking consist of methadone 50 milligrams once daily. He's also taken, as I mentioned before, the ibuprofen 200 milligrams. He's taking about 3 tablets every 6 to 8 hours for his muscle aches and fever relief. He has also taken 400 milligrams of Mucinex every 4 hours for his cough, and also Pepsid 10 milligrams twice a day for his stomach relief. Now, the patient does smoke. He smokes about a pack a day of cigarettes, and upon physical examination, he does appear to be sick with a shortness on breath on presentation, and his mucous membranes are very pale and they are dry. Now, the patient's, as I mentioned before, the patient's blood pressure and his BUN, his creatinine, and his white blood cell count is above normal range. And we are still waiting to receive back one more culture, but so far we know that there is some gram-positive results that we have gotten back. And again, this is highly suspicious of pneumonia.
After careful review, Mr. Sun has community-acquired pneumonia. This is proven with the fact that we saw his chest x-rays, which shows inflammation in his lungs. He's also having a shortness of breath, and he's coughing with sputum. His curb score is 4. We gathered this because he has a low blood pressure, an increased respiratory rate, increased BUN, and the fact that he also has confusion. At this point, our recommendation is that Mr. Sun starts levofloxacin 500 milligrams daily with Unison 1.5 grams every 12 hours for the next 7 to 10 days. We also recommend a yearly flu vaccine and his first dose of the pneumonia vaccine today. Upon discharge, we're going to talk to Mr. Sun about some smoking cessation programs, and we're going to schedule a follow-up with him in the next 2 weeks.